you guys. I'm on YouTube now. Bye bye. Okay. Hello. Um, Welcome. Good evening, everybody. Yes. Okay. Do we have anybody in the house this evening? So tonight's section was requested for, and we're talking about infection. We're talking about infection tonight. And I know that a lot of people have been asking me, let's talk about infection. So as I go ahead, would know more about infection. But before I do that, my name is Dr. Frederick Unubohai. This session here does not take the place of you speaking with your doctor. We're just here to advise you. Okay, we're just here to advise, and I think I'm waiting for some people to join me. Yeah, I am. I'm waiting for some people to actually join. And when they do, we will kick off immediately. So those that requested for the session are not here. I'm still waiting for them. I'm still waiting for them. Oh, I am waiting, and I hope that they join me here. And when they join me, we can now can kick off. But if I wait for, let's say, 10 minutes, and then there's no one, so we move. Okay, I'm still waiting. I'm still waiting. And I hope that I have people that will join me on this live tonight. But if I don't see anyone, I'll end it. Yes. Okay. There's still nobody. There's still nobody. I'm still waiting. I'm still waiting and waiting and waiting and waiting. Okay, I think we have somebody in the house. Hi, good evening. Welcome. Okay. I think I see you. Janice. Janice says hi. Yes, and who is here? Victor Joy says good evening. Okay, I see you, Victor Joy. Sharon is in the house. Sharon Kemi says good evening. Yes, I see you. So I think tonight will be very, very interesting because I can I can pin all your comments on the screen. Yes. Yeah, I can pin all your comments on the screen. So this is quite interesting. Good evening, Sharon. Um, I believe you can see what we have on the screen, right? Yes, we're talking about infection tonight. This should be fun. This should be very, very, very interesting. Okay, we have a comment here. Joy Sunshine. Oh, Joy Sunshine. Yes, I see you. Welcome. Yes. Good evening. How are you? How are you doing? Talk to me. So we have 4 people on the live stream tonight. And can you hear me at all? If you can hear me, say yes, I can hear you. If you can hear me, say yes, I can hear you. Let's go. Say yes, I can hear you. If you can hear me, I'm fine. If you can hear me, say yes. Say yes, I can hear you. Say yes, I can hear you. Okay. Yes, I can hear you. Yes, Baba. Okay, good. Yeah, I can hear you. Hearing you. Very good. Very good. Very good. Victor Joy can hear me. Janice can hear me. Okay. So should we start now or we wait for some more people? I'm doing very well. Sharon, I'm doing very, very well. I'm seeing all your comments. Yes. So should we go ahead or we should wait for some more people? Talk to me. What do you think? Should we go ahead? Yeah, talk to me. I should wait for, okay, wait for more. Okay, I'm waiting. So what you can do for me is that you can actually tap your screen, click on the like. You can share the live too. So click on the like button and share the live. I believe people will join us when you do so. Yes, this is what we're talking about tonight. Yeah, we're talking about infection. Hmm? We're talking about infection tonight. Now, this topic was requested for. I don't know if the people that requested for this topic are here. If you requested for the topic, please let me know. If you did request for the topic, okay, let me know if you are here. If you are here, talk to me. Okay, let's see. Let's see. Should we go ahead? There's no time. Oh, trying to see. Okay, should we go ahead? Let me do this. Somebody says wait for more. Okay. Sharon says wait for more. Okay. Jonsi Osas, I see you. Good evening, Sharon. Welcome. Good evening. Let me do this. I know what to do. I know what to do. Good evening. Good evening. Yes, I'll do this. No problem. I know what to do. Okay. Give 4. Janice says I should give 4 more minutes. 4 more minutes. Okay, I'm waiting. I'm waiting. But all the questions that we take tonight would be from YouTube. Hmm? All the questions that we take tonight would be on YouTube. So, should we go ahead? Should we go ahead? Should we start? What do you think, guys? Let's wait for more. Okay, Victor Joy says let's wait for more. But we don't have time. Now, all your questions and all your comments are appearing on my screen. I can see all your comments and I can pin your comments on the screen. So I'm waiting. I'm waiting. This is like 8 minutes past 8 p.m. Okay, we are waiting. Let's go. Let's go. Let's go. Welcome. So we are talking about infection tonight on YouTube. Yeah. Okay, 5 people here. Let's just start. Let's just start. Let's just start. Let's just start. So whenever you hear the word infection, whenever you hear the word infection, it means that there is a presence of microorganism. Are we together? It means there's a presence of a microorganism. Now, these microorganisms could be bacteria, could be viruses, could be fungi, could be parasites. Now, when these microorganisms get into your body, they multiply. Yes, they multiply. And when they multiply, they cause infection. Now, when they cause infection, they might lead to disease. So if you have an organism get into your body, multiplies, causes an infection, you might have an infection, but you might not have a disease. So there's a difference between infection and disease. Now, I know that this discussion is centered on sexually transmitted infection because people have been asking me, please talk about STIs, STDs. and we want to know more about it. So tonight we'll be talking about STDs, sexually transmitted infection. Now, whenever you hear STD, it simply means infections gotten through sex. Remember, there are different forms of sex. There is the oral sex, there is the anal. I will have to off this TikTok. I don't want them to ban my TikTok live because of what I shall be mentioning. You understand? I will have to end the TikTok live so that I can be only on YouTube. I don't want them to ban my TikTok live. So there is the oral sex, there is the anal sex, and there is the other part of sex. Now, you can get an infection through any of these routes. This is why we all need to hear this discussion tonight. You know, WHO released a publication last year and they said that every day there's over 1 million cases of sexually transmitted infection going on. Every day, 1 million. Now, inside this infection, some are curable, while some are manageable. Are we together? Some of the infections are curable, while some of the infections are manageable. You can manage them, but you can't cure them. So the ones that you can cure are the things like gonorrhea, chlamydia, syphilis, trichomonas vaginalis, and the rest. Now, the ones that you cannot cure, they include HIV, hepatitis B, human papilloma virus, and herpes simplex. These are the infections that you cannot cure, but you can manage them. Are we together? Okay. Okay, good. So you should know that infections occur in males and females. And the most funny thing about this infection is that some of them, or in most cases, they don't have any symptom. So you might have an infection in you and you don't have any form of symptom at all. So we call them asymptomatic. While there are other cases whereas an individual has the infection and he or she has symptoms. But before we go to the symptoms, there are so many other ways through which people can get this STDs or sexually transmitted infection. Example, when a woman is pregnant, so a woman can transfer the infection to her baby during pregnancy, during delivery, during breastfeeding. Some other people can get the infection. I think I see a comment here. Uh, okay, I see your comments. Yes, so they can just be controlled. Janice, your question, make it clearer for me so that I can pin it on the screen here. Okay. So I said some other forms of this infection can be gotten through sharp objects, those that abuse drugs. When they share their needles, they can transmit these infections. Now, the major route of transmission is through body fluid. When you exchange body fluid with your partner, you have one partner or you have more than one partner, you can actually exchange body fluids. And when you exchange body fluids, you can get infected. And remember, I said that these infections, some are curable, while some are not curable. So let's go to the symptoms. The symptoms in men, the first symptom would be asymptomatic. So some men might have these infections and they have no symptom. The other symptom you might see in a man would be whenever he wants to urinate, he has pain urinating. There's a question here. You said there are some STDs that can be cured. Um, that can be cured. Ask, can they just be under control? Yes, they can be controlled, but they cannot be cured. Yes, okay, I get your point right now. So these STDs cannot be cured, but they can be controlled. Example, HIV. HIV right now, HIV cannot be cured, but it can be controlled, managed to a form and a level whereby the individual cannot transmit the infection to the partner. So for men, when a man has sexually transmitted infection, STDs or STIs, as the case may be, he has pain urinating, he has this burning sensation urinating, um, he has discharge. A young man will tell you, I see something coming out of my male organ. It's like milk in color. I've received so many questions. Oh, doctor, I just woke up. I saw something coming out. Oh, I met my partner, and after some days, I noticed that I was having discharge. Sometimes they could have blisters, they could have sores, they could have swelling, bumps around the male organs. These stuffs could also be seen in the mouth. Yes. So some people that have these ulcers in the mouth might have transmitted the infection during during oral sex. Yes. There's a question here. Let's see. Okay, I see you. Welcome. Good evening. Welcome. Welcome. Welcome to YouTube. We're having a YouTube session, but those on TikTok can hear me. But I'll take all the questions on TikTok on YouTube tonight. So a man can have burning sensation. A man can have pain while urinating. A man can have um, discharge. Also, a man can have frequent urination, always going to urinate. Very important. He's always going to use the toilet. He urinates right now. In the next 20 minutes, he's urinating again. In the next 20 minutes, he's urinating again. We call that frequency. So these are some of the symptoms you can see in a man that has sexually transmitted infection. In women, what if a woman has sexually transmitted infection? How would she know? Again, from the very beginning, she might have no symptom, meaning that she can have a partner, she meets her partner regularly, but she has no symptom whatsoever. So she's just passing on the infection to the partner repeatedly, continuously. That is one. Now, what are the other symptoms a woman can have if she has a sexually transmitted infection? She can have pain again when urinating. She can have burning sensation when urinating. She can have lower abdominal pain when urinate, lower abdominal pain, not when urinating right now. And then one very, very common one that ladies usually complain about is a discharge. So she can have discharge. This discharge has its characteristic color and trademark because we know that there are over 20 types of sexually transmitted infections. Now, when a woman has discharge, as doctors, we want to ask her more questions. Oh, what is the color of your discharge? What is the smell? These characteristics would help us know what type of infection she has. Is it a bacterial infection or a parasitic infection? Is that clear? So she can have a discharge, foul smelling discharge. Then she can also have blisters, ulcers around that area, around her genital area, or around the anal region, or around her mouth. So this is why we are preaching and we are appealing that if you want to engage in oral intercourse, at least you should screen yourself and your partner because you might engage in oral intercourse and at the same time, um, how far, Baba? How you did? I'm on YouTube. I'm on YouTube, so I did YouTube. Yes, I'm just leaving my TikTok open, but the whole questions for tonight is coming from YouTube. So anybody that wants to ask me any question should move over to YouTube, and we'll respond to the question here on YouTube. So you can have ulcers, you can have blisters, you can have swelling around the mouth, around the anal region, around the genital region. The woman can also have painful intercourse. Yes, painful intercourse. So whenever she meets her partner, she's always having pain. These are some of the symptoms to take note of when a woman has sexually transmitted infection. Are we together? Can you hear me? Can you hear me, guys? Can you hear me? Are we together? Please let me know if you can hear me on YouTube. Let's go. Let's go. Talk to me. Let me know you can hear me. Let's see. Okay. Uh, I'm waiting. Are we together? Can you hear me? If you have any question for me, drop all your questions on YouTube, on this YouTube live. I'll take all your questions that pertains to infection tonight. Ladies and gentlemen, can you hear me? Okay, I'm seeing your comments. Let's see. Let's see. Um, yes, I can hear you. Somebody's asking me a question here on YouTube. So let me do this. Can a man get infected from a woman by giving head? This is a very interesting question. Can a man get infected from a woman by giving her head? So when you mean head, oral, right? Yes, the answer is a very big yes. Now, this infection, because he's giving her head, he's going to have oral. His infections will be oral around. Hi, welcome. I see you. Welcome. Who's here? Courage. Yes, I see you. Welcome, Courage. So it's possible that a man can actually get infected by giving a woman head. Remember, body fluids, and we said there are bacteria, and there's bacteria, there's viruses, there are fungi, parasites. So a man can get a viral infection. Example, example of the viral infection, herpes. Herpes. Now, people tell you in Africa, Nigeria, where I reside, they'll tell you that whenever they see blisters over their mouths, over the upper part of their lips, they say, I have malaria. That is not malaria, that is herpes. And we have two types of herpes. So we have the oral herpes and we have the genital herpes. Some people can actually have genital herpes on their lip. Yes, people can actually have genital herpes on their lip. So a man can actually get infected. Yes, if you're just coming, you are welcome. We are having a YouTube session. This session was actually requested for and is currently ongoing on YouTube. But those on TikTok can actually hear me at the same time. But if you want to ask me any question, all the questions should be directed to the YouTube live. Now, why is it bad? Why are we scared of sexually transmitted infections? Why are we worried? Okay, the word is not scared, it's worried. Why are we worried? You are a man, you are a woman, and you can hear me, and you have started engaging in, right, genital collision. We are worried because if your infection is not properly managed, is not properly attended to, there can be complications. Yes, for the man and for the woman. So where do we start from? Should we start from the man or the woman? Should we start from the man or from the woman? Let's see. Drop your questions for me. Drop your questions on YouTube in the comment section. Drop your questions. I'll take all your questions tonight. Yes. So where do we start from? I'm seeing comments here. Um, the thing called fever bombs. Okay, somebody's asking me a question here. It says, the thing called fever bombs, is it herpes? Yes, Janice. Now, you see, on the upper part of your lip, there are times you wake up, you see little swellings. I think I have made a video on that. Maybe I will make a detailed video concerning this. It's called herpes. And I said that there are two types. It's a viral infection. It's a viral infection. So we have the oral herpes called herpes labialis, and we have the genital herpes. So most times people have oral herpes. It has no cure. Mm-mm. So if you have it, it stays with you. As long as your immune system is intact, your immune system will keep the viral or the virus in check. But when your immune system goes down, let's say you have you are stressed, um, you are malnourished, what again? You are on certain forms of medications, your immune system can go down. And when your immune system goes down, this virus becomes reactivated. So when it becomes reactivated, you develop um, blisters over your mouth, and you say you have malaria. No, it's not malaria. Somebody's asking me a question here on YouTube. My balls get reddish after intercourse with a particular woman in the past, and the ball skin gets really dry afterwards. Uh, the ball skin gets really dry afterwards, my brother. I can't see. I can't see the other parts of your comments. Yes, yeah. Afterwards. I'm not going to take any question on TikTok tonight. All the questions would be on YouTube. So so my guy, your question is not complete. What's your take on that? But you get it, but never did oral. So why did you get it? Remember, I said there are two types. Viral, there are two types. There's the genital form of um, herpes simplex. There's the oral form. Most times, the genital is gotten through intercourse. Most times, gotten through intercourse. Have you heard this story where doctors tell people that when you see a newborn baby, don't kiss that newborn baby. Don't kiss the baby. Don't put your cheek over the baby's mouth. You know why? The baby does not have developed immune system. Now, for you as an adult, there are so many ways you can get oral herpes, yet you have not engaged in intercourse, the oral form of herpes, oral form. But the genital form is gotten through intercourse, whether vaginal routes, anal routes, oral routes. Does that make sense? And sometimes you can transfer the herpes simplex to the mouth. And when it gets to the mouth, you develop ulcers and the rest. That is for the genital. But some people don't have the genital herpes. The only one they have is the oral herpes. That does not mean they were involved in intercourse. Okay. Okay. So someone is asking me. It says my balls get reddish after intercourse with a particular woman in the past, and the ball skin gets really dried days after. What's my take on that? Okay, what's my take on that? My take on that really, um, I can't say what it is, my guy. I can't really tell you what it is because I don't know much about the whole story. You understand? In case you missed the introductory part of this whole conversation is just to educate you. Does not take the place of you speaking with your doctor. Hmm? Do you understand? Does not take the place of you speaking with your doctor. So if you want to speak with your doctor, please do so. But if you come online and think that we might know the cause of your problem, no, we can't really make any diagnosis for you here. Yes. Okay. Somebody says, hello, please. I just followed you on TikTok and subscribed to your YouTube channel. Okay, it's nice having you here. Um, give examples of how you get the oral herpes. So most times people you get this oral herpes. Okay, let me say this. Is this sometimes or most times? Sometimes you can get this oral herpes right from when you were young, much younger. So as kids, we share spoons, we share foodstuffs with our fellow kids around. We pick things and we put into our mouths. Now, when you do that, there's a very high tendency that a kid can get infected at that point. Yes. Hi, welcome. So we are on YouTube tonight. I'm just talking we're on YouTube, but TikTok is on. So any question you have for me will be taken on YouTube. So I was saying that what are the complications when a woman has sexually transmitted infections? What are those complications that she can suffer from? The complications are that she can develop problems with her so her fallopian tube can become Okay, are we back? Very good, we are back. Okay, we have 11 people on YouTube. 11 people on YouTube. Welcome, welcome. So, a woman can have sexually transmitted infection, and this infection can affect her tubes. Please listen carefully. The infection can block her tubes so that in the future she might suffer from infertility. She begins to find it difficult to conceive because the ova cannot move through the fallopian tube into the uterus. Can you hear me now? Can you hear me now? If you can hear me, say yes, I can hear you. Let's go. Talk to me quickly. Can you hear me? Can you hear me? Can you hear me? Let's go quickly. Talk to me. Yes, I can hear you. So we move. We move. We move. We move. Okay. I hope you can hear me. Yes. So a woman can have a problem with her tubes due to this infection. Let's see. It's breaking. Why is it breaking? Why is it breaking? Yes, I can hear you. Okay, very good. Thank you. You can hear me. So a woman can have problem with her tubes. A woman can have problems with pain, chronic abdominal pain. So every time she's having pain, repeated pain. Now, another complication is that this infection can affect her sexual life. So whenever she meets her partner, she's always complaining of pain, always complaining of pain. Ah, ah. And you know, there's no partner that would be happy that whenever he meets a woman complaining of pain, would want to continue making her pass through pain. It will strain their relationship. So it can affect intercourse, can affect the relationship, it can affect reproduction. Are we together? Now, for the which other symptom again? Somebody's asking, can infection? You are just coming. The answer, please respond to her in the comment section. You are just coming. I said this. And ladies and gentlemen, please, I beg you, if we are having a special session on YouTube, if it's 8 p.m., please do your best. I know we have different time zones around the world. I have people from New York, people from Ghana, from Zambia, from the UK, from France, Italy, joining this live stream. So please help me so that we don't keep repeating the discussion every time. I'm only going to take questions on YouTube tonight. It's deliberate. I really didn't want to be on you on TikTok live, just on YouTube. But I just wanted people on TikTok to listen and be a part of the discussion. But if you have a question for me, please drop your questions on the YouTube live and I'll attend to you. Yes, Sharon. This sexually transmitted infection can cause blockage of the fallopian tube in a woman. It can actually block the tube. And when it does block the tube, it can affect her getting pregnant. Now, for a man can actually suffer from the complications of sexually transmitted infections. How? Remember, I told you that Some men can have STDs and they are having discharge. A man can have STD. Somebody sent me a DM some time ago and said, I noticed milk coming out of my private parts. And that is not milk, that is a urethral discharge. So if a man does not treat himself properly, his urethra, the urethra is the tube in which your urine passes from your bladder to the exterior parts, or a man can release sperm, the tube that takes sperm from the man into the woman. So the urethra is that tube that connects from the bladder out when you urinate. Now, a man can actually have STD, and when this STD is not properly treated, this STD can cause that tube to narrow and cause what we call urethral stricture. So when he has urethral stricture, his urine would not flow like normal. You know, when a man, for the guys, when you go to the toilet to urinate, the urine comes out like tap. You know, you can travel. But when a man has a problem with his urethra and the urine is not coming out like what it used to, what you notice is that the urine begins to spill out. We use the word bifurcates, begins to spill out like a pipe that is blocked. So instead of the urine coming out straight, it begins to spray out. The urethra might have been um, obstructed. So someone is asking me a question here. I'm talking about infection. Oh my God, I'm talking about infection. I don't want anybody to deviate us from the discussion today. Please, I have a serious issue. I want you to advise me what to do. I have been having serious nasal congestion for as long as I was a kid and blockage of one nose. Please, you have any advice for me? Okay, my advice would be that you see an ENT surgeon. See an ENT specialist, ear, nose, and throat surgeon to help you, please. That's what I think you should do right now. I don't think you need any advice or any medication online. You should see an expert. Please. So let's not take us away from the discussion tonight. Don't worry. One day we're going to have a YouTube live session, Q&A. So ask me anything on YouTube. Yes, ask me anything on YouTube. But tonight we're talking about infection. So I was talking about the men. Yes, the men can actually get problems too with their urethra. Now, one very important question that I come across every time is that people say, Doctor, I treated this infection. After a while, it went and it came back. It went, it came back. Do you know that most people right now, they have what we call resistance? Antibiotic resistance means that the antibiotics is no longer working for them. These microorganisms have developed new tactics, they have developed new skills, new abilities to protect themselves from the power and the actions of antibiotics. Now, how do you get resistance to antibiotics? How? Among the whole or this discussion tonight, if there is anything that means a lot to you, then this particular section, please, you should pay close attention to it. Pay close attention to this section right now. Um, in Africa, I'm trying to say Africa. I don't know who will be watching this video tomorrow. In Africa, there is a very bad habit, and the bad habit is self-medication. Self-medication. What I mean by self-medication is that some people just wake up. Oh, I'm having low abdominal pain. I'm having low abdominal pain. Let me take antibiotics. Oh, I notice my urine is having a little smell. And let me take antibiotics. I notice a little discharge. Let me take antibiotics. And you keep doing this repeatedly. So you have taken ciprofloxacin, levofloxacin, ofloxacin, augmentin, erythromycin, clindamycin, doxycycline. You've taken all of them. How? You go on social media, you go to Google, you search for medications, you look for the medication, you buy and you take. Gradually, you are developing resistance. And this is why it's now so difficult to manage and treat some people with these forms of infection. Right now, we know that most microorganisms are resistant to one antibiotics. I don't want to mention the name, so it won't look as if I'm saying something to create panic here. Um, this resistance is a disaster. It's a public health emergency. So if you are here and you are fond of taking antibiotics without speaking with a doctor, without seeking professional guidance and counsel, you are playing with fire. You are putting yourself in harm's way. So many ladies are suffering from repeated, recurrent sexually transmitted infections because they have developed resistance, they were poorly managed. Some of them started the medications and then they stopped it. If you are just coming, you are welcome. And we are having a YouTube live session, and this session is currently going on TikTok. But I'm taking questions only on YouTube. I'm not taking TikTok questions. Hmm? I'm only taking YouTube comments and YouTube questions. Somebody saying something. Let me say this. Excuse me. I was told that my body is being too sexually active is cause of infection. This happens even after treating infection. Um, I don't know who told you this. I don't know who said this to you, but I don't think a doctor will say that to you. Yeah. Hmm? I don't think a doctor will say that. Now, one other problem we notice is that most people patronize the wrong set of medical practitioners. Let me leave it at that point. Let me tell you a story. So, a young man called me and told me that he was having a problem, and somebody gave him infusion, antibiotics, 30, 30 infusion because they were treating infection. So sometimes the people who manage you, sometimes you might have been meeting the wrong set of people, or you were meeting quacks, or you were patronizing those along the roadside. Do you understand? Um, um, yes, yes. So okay, I'm taking comments on YouTube. The only comment I'm taking tonight are only those on YouTube. Are only those on YouTube. It's deliberate. It's deliberate. Yes. Okay, let's go. So, madam, I think you should see a doctor to help you with the right diagnosis and the right treatment. Now, how can you prevent sexually transmitted infection? How? Okay, there's a question here. The question here. Okay, I see you. Welcome, welcome. Oh, people are moving over to YouTube. Very good. Welcome. I see you. Welcome. Yes, yes, I see you, Sophia. I see you, um, Vion. Yes, welcome. So, how can you prevent sexually transmitted infection? Let's go back again to A, B, C, D, E. I hope I remember all of them. A. Number one. A is what? Abstinence. Don't knock. Don't engage in what? Vaginal, anal, oral. Abstain. That is the first one. Oh, Glory. Oh, is okay. Welcome, Glory. Hi. Don't engage in that. That's the first one. Abstain. Drop all your questions for me on YouTube. I'm taking all the questions. Number two is B. B is what? Be faithful. Have one partner. The risk of you having sexually transmitted infection increases with multiple sexual partners. So, if you have more than one partner, there is a very high tendency that you can get infected with a sexually transmitted infection. Yep. So be faithful. One partner. Now, let's go to what? Let's go to C. Okay, people are moving over to YouTube. I see you. Welcome. Let's go to C. So C says use a condom. Protection. Protect yourself from um, STDs by using condom. Yeah, C. Yes, yes, yes. Oh, um, D. D talks about the use of drugs, medications. The use of drugs. Now, they are very, very potent and very, very effective medications. These medications should not be gotten via social media. These medications should be prescribed for you by a doctor, a medical doctor, not, there are so many doctors right now, so many doctors. A medical doctor that is licensed to handle humans. Yes. Okay. So okay, let me take some questions here on YouTube. So somebody is asking, what is yeast infection? You have not watched my video on YouTube. So I have a video on that. I have a video on YouTube, Sharon. I have a video on yeast infection. Yeast infection is a form. Oh, you didn't start from the beginning. It's a fungal infection. It's a fungal infection. So go through my videos on YouTube. You would see one of the videos I made. I called that video, I titled it Vaginal Candidiasis. So please watch the video. It's about 5 minutes or 6 minutes. I can't really remember. So please watch the video and it will give you everything you need to know about vaginal candidiasis and yeast infection. Please, yeah. So there's another question here on YouTube. What about urinary tract infection? Yes, someone can develop urinary tract infection from STD. So you have an infection caused by intercourse. The infection affects your urinary tract. So I mentioned it before. Your urethra can get infected. Your bladder can get infected. Your ureters. So there is urethra and there is ureter. mm, can get infected. Your kidney can get infected. So the kidneys, the two kidneys, the tubes that carry the urine from the kidneys to the bladder, your ureter, can get infected. Your bladder can get infected. And from the bladder, the urethra from the bladder to the exterior can also get infected. So it's possible that someone can develop a urinary tract infection from um, from the XTI. So somebody's asking me again on YouTube, if you get treated, if you get treatment and your partner doesn't, how likely is it to get the STD back? It's possible that you can actually be reinfected by your partner. This is why we tell people that, okay, every time I talk like this, I always give a disclaimer because I don't know who might be watching. Number one is this. I want to reemphasize again. Do not seek for treatment on social media. Do not. Do not seek for treatment on Google, via Google. Seek your care from a doctor. The reason I have to emphasize again is because when you speak with a doctor, most times or almost every time, the doctor will tell you, where is your partner? Oh, can I see your partner? It's important we manage you in conjunction with your partner because some ladies might be treated and the partner might be the one reinfecting them. Remember, some of these things are asymptomatic. So the partner might have no symptom, but he just keeps infecting and infecting and infecting his partner. So if you are being managed for STD, please encourage your partner to go along with you to see the doctor for treatment. Okay, so where was I? E and D, yes, D, medications. That is how you prevent. Then, then, very important again, get tested. Screen yourself. Screen yourself. So you are in a relationship, you have a partner. it's not out of place that you and your partner get screened and you get tested for sexually transmitted infections. Example: HIV, hepatitis B, um, human papilloma virus, chlamydia, syphilis, gonorrhea. You can get tested. You should get tested. Very, very important. You can get tested. You should get tested. And also, there are vaccines. So if you are listening to me right now, I want you to know that there are vaccines that can actually protect you from some of these infections. So we have what we call the hepatitis B vaccine, protects you from hepatitis B virus. So we have the hepatitis B vaccine. We have the human papilloma virus vaccine. We have these vaccines. But it's shocking and it's sad that most people don't even know about this. The only thing they know about is that I have heard about it. I have heard about it on radio. I heard about it on TikTok. I heard about it on Instagram. And it doesn't concern me. It doesn't concern you. One day, it might concern you. Are we together? Are we together? Can you hear me, guys? Okay, good. So drop your questions. I'm almost rounding up tonight. Drop all your questions for me on YouTube. On YouTube. I'm only taking questions tonight from YouTube. So drop your questions. Let's go. Let's go. Let's go. I think I'm enjoying this session here. I can actually pin your comment on the screen. Please. I just did. I just did. I just did. Because okay, so somebody's asking me on YouTube, please kindly brief us on the symptoms of gonorrhea. So if you started with me, I listed some of the symptoms or almost all of the symptoms. And gonorrhea has these symptoms. So for the sake of educating you, I'll mention them again. Remember, some people can have these infections and they have no symptom. So what are the symptoms? Burning sensation when urinating. Burning sensation. You feel like there is hot water coming out of your genitals. You always want to urinate. You have pain when urinating. Sometimes you can have discharge. You can have low abdominal pain. You can have fever. You can have body pains. Are we together? So these are some of the symptoms of gonorrhea. You can have discharge too. Yes, you have discharge. Yeah. It's okay. It's okay. No, it's okay. Trust me. It's okay. Yeah. Yes. Welcome. Welcome. I see you all. Welcome. The numbers are increasing. So let's do this. Let's do this very fast. So drop your comments, drop your questions for me. Let's take them very fast on YouTube. On YouTube. I'm only taking questions on YouTube tonight. Yes, it's deliberate. It's deliberate. I'm actually trying to move my live sessions to YouTube. Okay, let's go. What are the questions? I'm waiting. I think we are done. We are done tonight. We are done. So I spoke about STDs, what they are, the causes of STDs, how people get infected with STDs, the symptoms of STDs. Um, I spoke about the treatment of STDs are with medications, antibiotics, or antiviral medications, or antiparasitic medications, or antifungal. Remember, we have bacteria, we have the viruses, we have fungal infections, we have parasitic infections. So, depending on the type of infection you have, your doctor would prescribe medications for you. So somebody's asking me a question here on YouTube. Is it normal for a woman to have white discharge? Sometimes there are discharges without any sign or symptoms of infection. Okay, this is a very good question. A woman can have discharge, and this discharge can be normal vaginal discharge. There are certain times in a woman's life when a woman has discharge, vaginal discharge, and we are not bothered. So let's say A woman is ovulating, she can have discharge. A woman is aroused sexually, she can have discharge. A woman is pregnant, in some cases she can have discharge. But we are bothered and we are worried when she notices that this discharge, remember, this discharge is now copious, very large. The amount is so much vaginal discharge. This discharge, there are other symptoms associated with the discharge, like smell, fish smell, some smell like rotten egg, some smell like dead, dead meat, some smell like what again? These smells are very, very bad. Then discharge has color. Discharge is itchy. Yes, I spoke about itchy color. Very, 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 very copious. So these are some of the things your doctor wants to look out for. That is why I always appeal to you. Please, please do not see for treatment online. Stop moving from one live session to another live session looking for somebody to prescribe medications for you on social media. Looking for medications for someone to prescribe for you on social media. You understand? Okay, so drop your comments for me on YouTube. Drop your comments. Let's move very fast. We're almost out of time. I just want to make it 1 hour, 1 hour live session on YouTube. So um I'm waiting for your comments. Yes, yes, yes. Let's go. Okay, okay, I'm waiting. Any more questions? I believe that this session was very, very clear for everybody to understand. How do we test? How do we test for this? Is swab test enough? And okay, Nancy, thank you for your question. How do we test? I was waiting for this question. Trust me, I was waiting for this question. So I'm taking a pause because it's not right for people to just wake up and say I want to do swab test. Swab test is not the only test for sexually transmitted infections. There are other forms of tests your doctor will want to carry out from you. Hmm? Yes. And then there are so many tests. But the important thing I want everybody to take home is that your medical professional, your doctor knows the test request for you. I know that this generation wants to get all the answers online. So you want to know how to manage yourself online. No, it doesn't work that way. It doesn't work that way. I'm trying to be as sincere as possible. I'm not hiding anything from you. Because imagine somebody having STD and the person has oral form of infection, the person has immunosuppression. You just, as a doctor, you can't just request for swab tests. There are other forms of tests that you also request for. So the test your doctor will request for you is tied to you. It's not general. Oh, because I have a problem, therefore we all have STDs. Everybody must go for swab test. Because I see ladies, everybody. Oh, I did swab. I did swab. I did swab. It could be more than that. You understand? So there's a question here. Somebody's asking me a question. Dr. Fred, can STI cause lung problems? It's possible. Yes, 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 yes. It's possible. It's possible that sexually transmitted infection can actually cause problems with the lungs. Now, this is really deep. So let me try and break it down. You know that your genital region is just the genital, that area. Sometimes these infections can travel in your blood. Let me give you one example. HIV. HIV. Remember, HIV, the full meaning of HIV, human immunodeficiency virus. Some people can get infected with HIV, and HIV can travel in the blood and cause you problems in your immune system. And when it causes problem in your immune system, you can have problems with other forms of infection, like you can have pneumonia, opportunistic infections. So it's possible that STIs can cause you problems in your lungs. I made a video on staphylococcus. That video, I don't know how many people have watched it. That video is a little bit detailed, not for the medical community, yes, but for everybody to understand. So if you watch that video, you will really understand how people can get infected, the lungs, the brain, even the bones. So the body is linked. Yeah. Somebody's asking me a question after from the big words. This is not clear. Drop your questions. Drop your questions. Let's take questions. Let's take questions here. I'm so much enjoying this session. I swear on YouTube, it's very interactive. The platform here is easy to navigate. Yes. So more questions, please. On YouTube only. Okay. No more. Okay. 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 Let's see. Let's see. No more question, right? Okay. I think it's time to start rounding up tonight because I don't want to take this discussion more than the stipulated time. So what I want to appeal to every one of us is that please, I beg you, one passionate appeal, one very big appeal is that please stop self-medication. Stop self-medication. You might just be hurting your fallopian tubes. You might be developing resistance without knowing. Stop self-medication. Stop looking for stop looking for treatment online. Somebody's asking me a question here on YouTube. Says, can antibiotics help in getting rid of sexually transmitted infections like HIV on first day of being infected? Okay, this is a very good question. This is a very good question. Remember, I said from the beginning that we have bacteria, we have viruses, we have fungal infection, we have parasitic infection. Antibiotics, please listen carefully. Antibiotics only works for bacterial infection. HIV is a viral infection. So if you engage in intercourse, if you engage in genital collision, and for any reason you get infected with a viral infection, and then you begin to drink ampiclos, bicham ampiclos, you are only pouring water in a fire that is being caused by fuel, petrol. You're doing nothing. You're just wasting your time. This is why young ladies will tell you that, oh, I just finished having intercourse. I took Bicham Ampiclos. I took, what is the name of the medication? I don't know the name. I took Bicham. I took this. I'm fine. You're not fine, no. What if you get infected by a virus? Antibiotics will not clear viral infections. Antibiotics will only clear bacterial infections. Does that make sense? Does that make sense, guys? Okay, I think my time is up. My time is up. Yeah. Okay, my time is up. So I want to appeal to everybody. Thank you. I want to appeal to you first of all that please, I beg you, stop self-medication. Consult, speak with your doctor. This platform here is just to educate you. Does not take the place of you seeing your doctor. Don't joke with your symptoms. Don't hide your symptoms. Don't move around social media looking for treatment online or going to Google to search your symptoms. Yes, please, I beg you. And then I want to appreciate every one of you for tuning in, asking your questions, staying with me through this session. I want to appreciate every one of you. Are there questions here? Hi. Um, can a doctor use one blood test for many tests? And this question is not clear. One blood test, depending on what they want to test from you, they can use the blood sample, they can use other samples too. So depending on what they want to check, they can use blood, they can use swab, they can take all different samples. You understand? Yeah. So you can't just say because I want to test you, I just take only blood. You might take blood, you might take urine, you might take discharge. Discharge is not blood. So depending on your symptom, depending on the history and examination findings, your doctor will now decide and determine if he wants to use just blood or she wants to take just blood sample or urine sample or swab, a urethral swab or anal swab or oral swab. Depends. Yeah. Thank you very much. So if you have not subscribed to my YouTube channel, please do so. Subscribe to the YouTube channel. Encourage your friends to do so. Share the video. I'm going to post this video immediately after this live stream so that people that were not able to tune in would go back again and watch the video. Like I always say, um, good life, good life, nah sense. Thank you so much for your time. Somebody say asking me a question again. Okay, I was about rounding up. Let's do this again. Can one sample of blood taken be used for different tests? Yes, that's what I said. That's what I said. Depending on what we are trying to look for. If what you want to look for, you can't get everything from the blood sample. You might have to take other samples. You might have to take swab, discharge. Hmm? Yeah. Do you understand? So because it's blood does not mean that you must take only blood. What if there's a discharge? Are you going to leave the discharge alone? This is why I always appeal to you. Do not manage yourself. Sometimes, despite the fact that we've advised some people, they still would not listen. So whatever you want to do, you go ahead. The complications and the consequences, you bear them alone. And nobody would start telling you, oh, you now have complication. If only you knew, listened. No, you will have to pay for the ignorance. You have to pay for the carelessness and the stubbornness. This is why we are appealing. Please leave your body alone. Don't try to manage yourself. You are not a doctor unless you are a medical doctor. I'm very, very specific. Unless you are a medical doctor, there are so many doctors around. Unless you are a medical doctor, then you can, to an extent, even as doctors, when you are sick, you need another doctor to manage you. So please, I beg you, I beg you, don't do that. Don't. If I have a phone and my phone is bad, I'm not an engineer. I'm not an engineer that fixes phone. I will have to take my phone to an engineer to fix my phone because I wasn't trained in that area. So please allow those who were trained in that area to handle your device for you. Hmm? And allow the doctors who were trained to manage you, take care of you. Yeah. Thank you, everybody, for your time. God bless you. I have to sign out right now. I'll upload this video on my page here on YouTube. And I hope we can get more views, get more subscribers. Yes, more subscribers. We need them. I need the subscribers. So please encourage your friends to subscribe to my video on my YouTube channel. And then God bless you. See you some other time. We'll be having more of these YouTube live sessions. One day I will have a Q&A session on YouTube. You ask me your questions and then we attend to them. Take care. Bye bye. And God bless you. Bye bye.